This is part of our Obesity Help 2025 Get to Know segment. And our guest of honor today is Dr. Batra and his office coordinator, I believe, is
Yeah.
Miriam. She's going to be joining us as well. So we're going to get to know these folks because they're going to be attending this year's conference. And we're super excited about them attending. Can't wait to meet them in person. And we're going to give you all an opportunity to get to know them and what they're about. So, first thing I'd like to know, Dr. Batra, with you, how does one end up being a plastic and reconstructive surgeon? Can you tell us a little bit about your journey?
Yeah, absolutely. I actually, just to step back a little bit, I actually wasn't interested in medicine and went to school to be a writer.
Hmm.
And that's something I've gotten back to in the last couple of years. Wrote a book recently that got published and is being picked up for a movie, in fact. But
Oh, very cool.
being a immigrant son of Indian parents, really didn't have any options to do any liberal arts. So they said, pick it out, doctor or engineer. And I ended up going the route of medicine. Uh, when I got into a residency, I realized that everybody in the surgical residency is gung ho. We're going to become heart surgeons or neurosurgeons. And I used to spend a lot of time with a heart surgeon. And he said if I had to do it all over again, I'd be a plastic surgeon. So I actually took his sage advice because he realized he was working hard day and night, up and then middle of the night for emergencies. And the plastic surgeons were kind of doing their elective work during the day and going home and being with family. So I ended up using his advice as my launching pad. And
Wow.
after 5 years of general surgery and doing a year of trauma, I ended up at UCSD for plastic surgery. And then 2 years after my plastic surgery fellowship, I ended up doing I was interested and still interested doing pediatric plastics where you go and repair congenital birth defects and cleft lips.
Oh, yeah.
Still part of my practice. And so I did specialized training in that and craniofacial surgery.
Hmm.
And then I opened shop in San Diego in 2001. And at the time, the one of the main procedures going on was something called a banded gastroplasty, which was an old time procedure for weight loss. And I ended up getting a lot of patients coming in with massive weight loss that no one wanted to do anything about because they were just extremely difficult cases. So I kind of was able to get into that specialty early on over 20 years ago, and have really refined my skills over the last 2 decades in it.
Wow. 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 That's such an interesting path for sure.